Hello everyone. Today we are going to talk about very common conditions called anemia. There are different kinds of anemia, but the topic of discussion today is iron deficiency anemia, which is very common in India, specifically in ladies and in their reproductive age. So there are four causative factors, or we can say the conditions which can lead to iron deficiency inside the body. First is if there is any deficiency in the diet. Second is if there is excessive blood loss through which the iron also definitely comes out. Third is if the absorption is very less from the diet, which is a rare condition. Fourth is physiological condition called pregnancy, where the demand is more, and if there is deficiency in the diet, so that can lead to anemia. So what are the signs and symptoms of anemia? Mild anemia will not cause any symptoms which a person can feel, but moderate to severe anemia can cause the following symptoms. First is pale skin. So looking at the person, you can make out whether he is anemic. Second is fatigue, which is unexplained fatigue. Third is breathlessness, because as you know, the hemoglobin can carry oxygen molecule through the body. So if the hemoglobin is low, oxygen is also low inside the thing. So people feel breathless. Fourth is generalized body pain, and fifth is even loss of appetite. So when you combine all these symptoms, you can suspect anemia in a person. So the treatment and investigations for anemia is investigation is done through the blood test, which is very simple, complete blood count, and we do peripheral smear to see what kind of cells are present and what kind of anemia is it. And the treatment depends on the underlying cause. If there is deficiency in the diet, definitely more green leafy vegetables and all kind of vegetables which contain more of iron content can be prescribed, and a lot of non-veg in eggs and chicken and fish can provide a lot of iron content. And we give, if the deficiency is lot, then we can prescribe hematinics, which is tablets in the form of which contains ferrous sulfate or ferrous fumarate for 2 to 3 months, and then we check it again and then continue with the medicines. As you all know, iron is the most essential building block of forming hemoglobin as well as red blood cells. So when there is a deficiency of iron inside the body, that leads to iron deficiency anemia.